Okay, Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. Welcome to our session today on impacting health policy as a medical student. My name is Fariya. I'm a first-year PEDS resident at Baylor, and I'll be your moderator for today's session. Okay. So just to start with some beginning or gathering with recitation of the Quran, I'm going to be reciting a few ayahs from Surah Al-Alaq. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم اقرأ باسم ربك الذي خلق خلق الإنسان من علق اقرأ وربك الأكرم الذي علم بالقلم علم الإنسان ما لم يعلم. So just to translate this, in the name of Allah, the most compassionate, the most merciful, recite, in the name of your Lord who created man from a clinging substance. Recite, and your Lord is the most generous, who taught by the pen, taught man that which he knew not. Okay, move on to the next slide, please. There's a little bit of background on the AMWPA, or the American Muslim and Physicians Association. AMWPA is very much an organization created for the community, intended to serve all members of the community. So our passions really include education, empowerment of women, and serving healthcare through those in need, underserved opportunities around the community. We do a lot of health fairs around the community, provide resources, provide health education, and help really address chronic preventative needs to help prevent progression to other conditions later on in life. We have a lot of mentorship programs that we encourage you to join, and we'll share information about later during our session today. So I have the honor of introducing our guest speakers, Yushra and Maryam, who are both incredible student leaders with the Texas Medical Association. Really excited to see what we can learn in today's session.
Okay, so first we'll go ahead and start with what the TMA actually does. So it is the statewide organization that shapes healthcare policy in Texas. And so it directly impacts scope of practice, insurance policies, patient care, patient access to care. And it gives an opportunity for students to have a real voice in policy. And opportunity to advocate for patients, build leadership experience, and influence real change. So now each of us are going to talk about why each of us got involved in TMA. So for me, it just begins with, as I was getting involved in medicine, the first kind of exposure that I always had was free medical clinics, whether that was like through the masjid or through the community. I was really like involved with the free clinics. And what I always noticed is there was so many barriers to healthcare and healthcare access. So many times we would see patients and they'd be like, this is my first time seeing a physician in like 5 years because I don't have insurance, or like other, problems that they had in order to get the actual care that they needed. And so I realized, there's so much you can do from a clinical standpoint to help a patient, and to get to like the root and the core of the problem, you actually have to be able to impact healthcare policy. And so that's why I got involved with TMA, and I'm really excited to share everything that I learned.
Okay, hey everyone. So I'm Maryam, and I'm also going to be talking about how I got involved in TMA. So for me, my mom's a physician, and so from very early on, I saw the medical field from her point of view, and so I was able to see kind of the problems that she was facing. It was a unique perspective that you don't necessarily get in medical school. So when you join the TMA, you see all these physicians and you hear the problems that they face on a daily basis, and that tells you what you're going to face in the future. So that was part of the reason I got involved, to learn more about what our future holds, but also because I saw issues, just like Yushra mentioned, about people not being able to access care. In when doctors have to go through all these difficult processes just to get their patients' procedures approved, and then the procedure's not even going to get approved. And I think social media has really amplified these issues, so you learn a lot more. And that's why I got involved, because TMA gives you a way to take steps towards a solution. So yes, I think it's really important for everyone to pay attention to this talk, because this is a way for y'all to make a difference as well. Okay, so I'm going to go ahead and talk about the TMA structure. The structure can be very confusing at first. First of all, you should know that TMA is the big medical association in Texas. It represents all the physicians in Texas, which is over 60,000, making it the largest state medical society. And it's made up of various bodies, including medical students. So you can look at the diagram just for reference, but there's a sections area. And so we are the medical student section. We'll talk about that a little bit more. And what's nice is that every medical student in Texas is automatically a member of the TMA. So you don't have to pay anything. The school takes care of it. So really important to take advantage of that membership. And then you can see that there's the House of Delegates. We'll talk a bit more about that later as well. And then there's councils. I'm part of a council. Again, we'll expand on that. But just know that TMA is made up of all these moving parts, and all you need to do is enter in one of these parts. And usually we enter through the medical student section. And that's how you start getting more and more involved.
There's also ways to get involved at a local levels. And so the two ways to do that is either through your medical school chapter or a county medical society. And so with the medical school chapter, so every school in Texas, so like Lubbock, UTMB, whatever, they all have a TMA chapter. And so you can join that chapter and be a part of the school organization and the leadership there. They also have like service events, for example, like giving out helmets for pediatric patients, at like different service events in different schools. And then you can also be a part of mentorship and resolution writing within your school's chapter. And then also there's the county medical societies. So there's like different societies within each county. So there's one in Dallas, in Terrence, Harris County, and you can get involved through that as a medical student. And you can be a part of mentorship programs there or join committees in those counties as well. And then there's also opportunities to be a delegate, and we'll talk about what a delegate is later on. But that's an important term. So you can either be a delegate through the county medical society or even through the medical school chapter.
Okay, so now I'm going to talk more about the medical student section. First, I do want to mention that we are talking about TMA right now, but you might have heard of AMA, and that's the American Medical Association. So TMA is a part of AMA. And then, so it's like global scale, national scale, AMA, and then state society TMA, and then we're going to narrow in on the medical student section. So the medical student section was created in the late 1970s. And what's really cool is that you can see this banner right here that shows the 50th anniversary. So it was the medical student section's 50th anniversary this year. So it's been around, and the fact that it's been around means that the TMA really values the medical student perspective, and physicians really value your perspective. So that's why the TMA allows medical students a voice in forming TMA policy. We'll expand more on that. You can create resolutions, so things that you think the TMA should advocate for, and all the time, medical students are submitting those things. So TMA values that, and all 16 Texas medical schools are a part of this, and that means that there's over 9,000 student members, and to basically be in charge of all this is the Medical Student Executive Council. So we need officers because clearly there's so many people in the medical student section. So we have the executive council that organizes everything and kind of leads the medical students. So there's different positions on the executive council. You can see on the side here that there's the chair, the vice chair, reporter, the TMA delegate co-chairs, the AMA delegate co-chairs, the immediate past chair, so just the person who used to be the chair helps advise, the student member on the TMA Board of Trustees, and then the alternate delegate to the TMA delegation to the AMA. So a bunch of positions. You can really apply to any of them with no experience except for a couple that have a different application process. So you can look into that if you're interested. But these applications are typically due in March every year. And it's a really cool opportunity to get involved. Yushra has been involved on the executive council. This is going to be her third year. So she'll talk more about that. But essentially what you need to know is that you're in the medical student section, and then the executive council will guide you and guide all of us in this medical student section.
Okay, so now we're going to talk about the House of Delegates because that comes up a lot when you get involved with the AMA. So, what is the House of Delegates? It is the policy-making body of the Texas Medical Association, and it's like what pretty much it's what makes up the body that is going to vote on different resolutions that are going to be passed and become official TMA policy. And so, how do you even become a member of the House? And so, being a member of the House is what qualifies you to be a delegate, and a delegate is what is referred to as a voting member. So there's different ways to become a delegate. So, like we talked about, those county society delegates through, like, Dallas County Medical Society, Harris County Medical Society. And you are like essentially voted on by those counties to become a delegate. There's different councils in TMA, as Maryam talked about. And so those are the chairs of those councils. They are like automatically considered a delegate. Board of trustee members, Texas delegates to the AMA. There's also delegates from each medical school. So every medical school, like we mentioned, has a TMA chapter, and each of those chapters has a delegate and an alternate delegate. So the delegate will like get to vote on resolutions, and the alternate delegate fills in when the delegate is like not available. And then there's also delegates from the international medical graduate section, and then the resident and fellow section, and then the young physician section. So Fariya, who's our host, she's actually the delegates from the resident and fellow section. And then, so like I mentioned, so these delegates then vote on resolutions brought forth to the HOD. And now you're like, okay, but like, how do these resolutions even get there? So what happens is that like these resolutions can be brought forth by like any member of the TMA, whether that's like a medical student, resident, physician. Let's say you see like a gap in healthcare in Texas, and they're like, you know what, there needs to be a TMA policy on this. So you can actually draft up a resolution, and your resolution will go to one of the councils, one of the different committees. And the committees are financial and organizational affairs, medical education and healthcare quality, socioeconomics, or science and public health. So whatever category your resolution falls into, it'll go to that committee. And then the committees will discuss the resolutions and decide if they want to adopt the resolutions. So that means like they want it to pass as official policy for the TMA. They want to like not adopt it, or they want to refer it for study, meaning like they want more work on this. There needs to be some like editing like done in the resolution, or there needs to be more like studying done. And then so they want to refer it to study so it can be brought back once it's like repolished a little bit. And then so these resolutions are then discussed at the HOD sessions, right? So the councils would be like, we want to adopt these ones, we don't want to adopt these ones. And then like and then at the HOD sessions, which take place at TexMed, people will be like, wait, why did you guys like not want to adopt that one? Like, I kind of want to adopt that one. And they'll give testimony. So you'll hear the word testimony when you join the TMA, and that's pretty much like someone going up and like vouching for a resolution. So like they go up and they're like, I think like, this is really important, and this is why I think it's important, and this is my personal experience with this, and this is why I think this needs to be policy. And then what happens is like voting takes place. So if you guys like see the pictures, the first picture like on the left, there's a little clicker that I'm holding. That is how everybody that's a voting member gets to vote. And you get these like when you're at the conference, and you can vote like, yes, I want this resolution to pass, or no, I don't want it to pass. And then just some of these other pictures. So the one next to the clicker, that's like a full room. It's like not filled, usually filled when there is an HOD session, but that's like people from all over the state, like I said, from the different counties, delegates from there, different medical schools, the delegates from there, is made up of the HOD session. So people from all over the state come and they vote on these resolutions. And then if you see the picture on the bottom left, that is a medical student actually giving testimony for a resolution. So he was a medical student resolution. So that means he actually wrote it, or like his school, like, they came up with it together, and then they are actually like talking about why it's important. And what's really cool, as Maryam mentioned, there is a medical student section, right, within the TMA. So whenever a medical student is up there, like giving testimony or, being involved in any way, or they bring forth a resolution, all the medical students come together and are like backing up that medical student. So even though, all this may kind of sound a little intimidating, like going up, giving testimony, writing a resolution. You have a lot of support as a medical student from the other medical students that are involved. So it's a really great opportunity to be a part of real healthcare policy within Texas.
Yeah, and then the cool thing about that student giving testimony on his resolution was the TMA wanted to refer it for study, so bring it back next year. But then after he gave his testimony, other physicians came up and they were like, oh, we agree. We think his resolution should pass because of this, this, this. And they gave their own experiences. And so then his resolution like flipped. It went from refer to study to adopt. So then that was just a really cool thing to witness that, oh, as medical students, you can totally actually make a difference. Also wanted to show y'all, let's see if I can go back. Nope. Yes, okay. Wanted to show y'all the picture on the top. That's from this TextMed. So just a couple of weeks ago, you can see that there's a bunch of medical students in this picture attending the medical student specific meeting at the TextMed conference. So these people are not all delegates. They're not all the person from their school that's going to vote on resolutions. They're other officers, or they might not even be officers of their chapters, but they just wanted to come. So anyone can come to TextMed, any medical student, and all these people are from different schools. I'm in there somewhere. But yes, so you can see that it's a really cool thing to be a part of, and other people are also a part of it. Okay, let's go to my side. So I have had a few different roles. Last year, I was the alternate delegate for my school, so A&M. I was the alternate delegate to TMA, which just means that I kind of help the main delegate. If she wasn't able to go to meetings, then I would go in her place. This year, I'm the main delegate, so I'm A&M's delegate to the TMA, which means that on those clicker devices, I had one of those and I was just voting, yes, I think this resolution should pass, or no, like, I don't think this resolution should pass. I don't think it's a good policy, or it's not feasible for the TMA, something like that. And then I'm also on a council as a medical student representative. So all these councils, there was like socioeconomics, there was science and technology, public health, etc. All these councils have a medical student representative because again, they just want medical students to feel included and have a voice. And if they ever need the medical student perspective, they have someone to turn to. So I am currently the alternate medical student representative to the Council of Socioeconomics. And really what that means is I just listen a lot because I don't understand a lot of the things that they're discussing, which is totally fine. You can be looking things up on the side. They don't expect you to understand everything. It's really just an educational thing for you where you're learning about all these different socioeconomic policies that physicians are very invested in. And they're like, we need to have this stance on it so that when we go to the government, we are going to tell them that we want this, this, and this when it comes to this policy. So they're always talking about insurance companies and all these things that I still need to learn. But yes, you can see all these pictures that I've clearly been going to things. I went to Corpus Christi a couple of weeks ago for TextMed, and then in September last year, I went to El Paso for the Business of Medicine conference, which was, again, a more educational conference. There was no voting or anything like that. But Yushra and I, we just went to both of these conferences together. So we're in a lot of pictures together. Again, the medical student section on the side, you can see the medical students that went to the Business of Medicine conference. So it's a smaller conference, less medical students, but we're standing with the president of the TMA. So that's really cool that they care about us and they take pictures with us. We also met the new president of the TMA, because it switches every year, at Corpus Christi. He's like an ENT surgeon. And then, yes, there's like a poster that I had. And then there was like the president's meeting, so our president couldn't go, so I stood in for her. And so you on the side, you can also see like all the presidents sitting at this long black table. And basically, there's so many things that you can do. And these are just some of my roles.
Okay, now I'll talk about my roles. So I started off getting involved in TMA as a medical student section reporter for the executive council. And so I think getting involved in the executive council is a great way to get in like to start your journey within TMA, even though I know it kind of sounds a little intimidating, like, oh, executive council. But like Maryam said, there aren't that many positions that require previous experience. I think the ones that do require previous experience are like the chair, and like if you do one of the delegate positions, you have to have been a delegate at your school. And so I had no previous experience in TMA, and I just like went for the executive council reporter. So it's just to show everyone, you don't have to have previous experience to get involved. And if you just, when I first joined the TMA, I had literally like no idea, like, like all of this, like I never attended a like educational information like session like this. And all of these like terms that probably sound like gibberish to you guys right now, like definitely sounded like gibberish to me. But like I think Maryam also mentioned this, if you just join one thing, you'll understand and you'll learn as you are already a part of it. So you don't need to like understand everything and know like, the ins and outs of TMA and like how voting works to get involved. You can just join and learn as you are already a part of it or already in a leadership position. I was also, so the reporter pretty much, they take minutes at the meetings and they like post them and kind of distribute information for other medical students. I was also the AMA alternate delegate to the Texas delegation from the medical student section. So Maryam also mentioned this. The TMA is like the governing medical body within Texas. But the AMA, the American Medical Association, is the governing body for like these healthcare policies within the US. So every state like has their own, like, how we have TMA, there's probably like a Wisconsin like medical association. Like every state has their own state's organization. And then every state also has their like delegate members. So the Texas delegation to the AMA are the people that actually vote for like Texas's points of view at the AMA. So so how like within Texas, there's like people from different counties voting on Texas laws. So for the AMA, there's people from different states coming in, all in like one room, voting for policies that are going to be officially adopted by the American Medical Association. So a lot of policies that the TMA adopts at like from the House of Delegates, then those policies that are more likely to need national advocacy, those go to the AMA to be advocated for, and the Texas delegation does that. And then I recently just got elected as vice chair, so I'll be helping like oversee a lot of the medical student section, be helping with the BCC, so that's like the committees and councils, and the medical students are involved with the committees and councils. And then these are just some images. So on the right, where we're kind of holding the awards, so Texas A&M actually won Chapter of the Year that year. So if you are really involved, like, just through your local chapter, you can apply for these awards, and then your school could win that award, and, you can like put it on your resume and things like that. So that was really exciting. And then there's also a lot of free stuff that you get at these conferences, which is like always fun. So like the picture above, the one of the awards, we're holding the mugs. Those are just like some free mugs we got, and like a lot of other like cool little gadgets. And then this is Fariya, like over here in the blue hijab. And then on the left here, this is actually a resident that's in the field that I want to apply in. And so it's a really great like networking opportunity. Getting to talk to people like residents and physicians from all over the state, because especially if I'm going to practice in Texas one day, it's a really great opportunity for medical students in Texas to get that networking opportunity. And then Maryam already mentioned this, but there's also a poster session that happens, and so it's a really great opportunity to go to these conferences, because first of all, like, now first of all, you get a lot of exposure, you get to learn a lot, you get to impact healthcare policy. And then also the other, side of things, where when you're applying for residency, it's getting a lot more competitive. They want you to be involved in conferences and research. And so TMA and TexMed and the conferences that TMA holds kind of gives you the opportunity to do all of that all in one place, Yeah. Thank you.
Okay. Let's see what's next. Okay, so now you're wondering how to get involved, right? So I've made a list in what I think is order of commitment level, roughly, give or take, But the first thing that you can do that's super easy is whatever your med school chapter is, join them and volunteer with them. So they're probably holding events, and it's just easiest to go to their events and go from there. So you can volunteer with them. Like for instance, we did a volunteering event last semester in where for Halloween we gave kids healthy food and they took it, they liked it. So that was like an easy way that people could get involved with us, right? Put their foot in the door of TMA. The next thing you can do is present a poster at TextMed, especially if you're already there, just submit a poster. It's really nice because they print it out for you, so all you need to do is submit it, and then you can just stand by your poster. And there's also a People's Choice Award, so your poster could win an award if people vote for it because they like it. So that's really cool. You can also attend First Tuesdays. We'll talk about that a little bit more, but this is when you go to Austin, to the state capitol, and you get to talk to legislators face to face. Medical students have a specific First Tuesday for them as well. So that's a really cool thing. It's 1 day commitment, and you drive down, talk to them, drive back up. The next thing you can do is provide testimony for someone's resolution. So Yushra was talking about this. We also just mentioned how that one student gave testimony for his own resolution. He wrote a resolution, and then he basically gave his experiences on why that resolution is important. So you can do that for someone else, especially if the authors are not able to attend TextMed when people are going to be voting on these resolutions and they're really talking about them at TextMed. If the author can't attend, you can basically advocate for their resolution on their behalf. So that happened to me, in where it was on firearm safety and education for medical students and residents, how important it is to make sure that there's firearm safety in our curriculum, especially as medical students, because we're going to be counseling on firearm safety when it comes to psychiatry or when it comes to pediatrics. So someone wrote a resolution that there should be this firearm safety education, and that resolution was a little controversial for whatever reason. And I basically just went in one of the smaller meetings and gave testimony. And I just read their experiences on why they think this is so important. So that's really easy to do. You attend TextMed and then you give testimony for someone. You can also join the resolution review committee. And what that means is all the medical student resolutions are due around October-ish. And then in October-ish, also the resolution review committee will open up, and where medical students are able to review all the resolutions submitted and give feedback. And that's really important because when me and Yushra wrote a resolution, we submitted it, and then we got feedback from the review committee. And then we edited some things, made it better, and eventually we got to our final draft that got submitted to TextMed. The next thing you can do is join a BCC, board, council, or committee. Again, I'm on the council of socioeconomics, but there's so many that you can join. There's like emergency medicine, infectious disease, cancer. There's so many. So that's one thing you can do. It's basically you meet online for the most part. A lot of them will have one in-person meeting at TextMed specifically, but for the rest of it, you're meeting online occasionally. For me, I think we met online 3 or 4 times in this past school year, and I just basically took notes. So again, low commitment, and you learn a lot from that. The next thing you can do is write a resolution. So again, a resolution is you feel very strongly about something and you want the TMA to advocate for that thing. And so you write a resolution, and then TMA can adopt it and make that official policy, something that they will advocate for on the state level or even the national level if they take it to the AMA. So we'll talk more about writing a resolution in a bit. And then you can also become an officer of your school chapter. And so that is like, again, I'm the delegate for my school chapter. So I vote on behalf of my school on different things. But you can become the treasurer, the president, the vice president. There's so many different positions in your school chapter specifically. And so you'll just be on their leadership. And that's very, very important. And then the most involved thing that you can do is, again, become part of that executive council. And so Yushra, she's been on that. She had those different positions. Because you are in charge of the whole medical student section, essentially, it's going to be like the most work, but when you put in work into something, you also get a lot out of it. So yeah, these are the different things you can do. And I think next we're going to talk about resolution writing. So a resolution, it's basically um, how you change policy. You're telling the TMA, like, this is what you should advocate for. So to write a resolution, the important thing is you should be brainstorming ideas. You should be figuring out, what do you find important? What do you value? And for the ideas, they have to be feasible and they have to be in scope of the TMA. So the reason I say that is because a lot of time medical students will have a really good idea, but it's going to be shot down. And that's because A, the TMA can't reasonably do anything about it. It's just not feasible, or it's not in scope. So they don't really have the resources to put behind it. And that's important because there's so many things already that TMA does. So the resolution should kind of be like in line with the things that they're advocating for, essentially. Um, and it also has to be relatively unique in that that idea or resolution is not already been written. So they have like a TMA policy finder, and you just search your resolution idea up essentially, and then you need to see what they already have on that. So on the side, I searched up follow-up because our resolution was about improving post-operative follow-up for rural patients. So, they have their surgery, they get lost to follow-up. So the goal was, let's improve that. Let's get more people back into their finish their care essentially. So what I had to do was I looked up follow-up because that's kind of like the buzzword of the resolution. And then I scrolled through everything and I looked, is this already there? Is TMA already advocating for this? And it wasn't. So then I knew that I could go ahead. So that's like one of the first things you should do. And then you need to figure out the why for your resolution. Why do you think it's important? Because that's going to be the beginning. You're going to write your whereas clauses, and these are going to be this is the justification for your resolution, why you think it should pass. And you should be getting, articles from the literature, news sources. These should be evidence-backed reasons. And then at the end, you write your resolved clauses, and that's exactly what you want the TMA to do. So I'll pull up our resolution that we wrote as an example on the next slide. Okay. Yeah, but before we do that, I can talk about like some of the resolutions that were submitted this year from the medical student section. I have it on the side over here. So you can see like some of the different topics that people felt very passionately about. Like this first one was expansion of TMA medical student loan program for low and middle class SES medical students under the new federal student loan cap. So again, financial reasons. Medical students have so many reasons to want this to pass. We all feel that financial struggle. And so one medical student felt strongly about something, so they wrote that resolution. The firearm safety and violence prevention in Texas, that was the one I gave testimony for. Opposing legislative oversight on medical school curriculum. So that one has an interesting story because last year, the Texas legislator, they tried to take away pass-fail for medical students. A lot of schools are pass-fail, especially the pre-clinicals. So before you're doing your actual like clinical rotations, it's pass-fail. And so the Texas legislator, they wanted to take it away. And medical students from all over Texas did emails, phone calls, very loudly, essentially voiced their displeasure and their disagreement with that. And so one medical student, took the extra step and they wrote this resolution. And that I don't actually remember the actual TMA decision on it, but it was like a positive like decision. So yeah, that's like something happened. One student felt strongly. They wrote a resolution that, the government shouldn't get to decide what medical schools do for their curriculum. Medical schools should decide that on their own, which, that makes sense. And again, you can see that there's so many other topics. There were 16 resolutions submitted from the medical student section. So this is just some. Other topics were like the expanding Medicaid coverage for medical nutrition therapy, or advocacy for respite care for patients with mental illness. So there's all these different topics. And now I'm going to show y'all our resolution. And so you can kind of have like a concrete example of what they look like. So I have that here. Okay, so I'm just going to run through this pretty briefly, but the first thing you have is your title. So that's, for us, it was improving post-operative follow-up completion for rural Texans. And the reason I thought this was important is because I was doing a research project and we were following up with patients because they had a clotting event that happened to them. And so we had to figure out whether they had some clotting disorder. Um, and so when we were calling, and so when we were calling patients to see whether they had a clotting disorder, we found out that a decent amount of them never even got their testing done. So they had their surgery, it was a bariatric surgery. Then there was a major complication from that surgery. They had a clotting complication. And so then they were discharged and told, hey, you should be on this medication now for 3 to 6 months and make sure you get tested for a clotting disorder. And a lot of those patients just didn't get the testing done. And so I was like, okay, they didn't finish their care. They didn't, there was like a loss to follow up there. And so I felt it was important that we improve post-operative follow-up completion then. And these were a lot of rural patients. So that's why I made it for rural Texans. And like one kind of striking thing about that is one patient, not only did he not get his like testing for a clotting disorder, he also stayed on that medication, the one that you're on for 3 to 6 months, for like up to 2 years. And that can be really dangerous because it was a anti-clotting medication. And so he was basically at risk of easily bleeding out. And so if he didn't actually have a clotting disorder, that's really bad, essentially. So this experience pushed me to write this resolution. And so again, like I just explained that here on the time sensitivity and urgency, that's really important when you write a resolution. And then you write your testimony, so your experience. So what I just said, I would write that down as my testimony. Okay. And then you have, yes, your resolution itself. And for me, this would fall under the Council of Socioeconomics. So it's kind of funny that when I was in my Council of Socioeconomics meeting, because I'm the medical student representative, this resolution came up because that's what this resolution falls under. And so I could listen to what the physicians were saying about it, essentially. But okay, yes. So you have your whereas clauses in the beginning where you're writing why this is important. And then you have your resolved clauses at the end, which is what the TMA should do. So I'm going to give like a brief example that whereas rural Texans face long travel distances, limited specialty access, and fragmented care transitions after surgery, and greater travel distance has been shown to substantially increase the risk of loss to postoperative follow-up, with patients living more than 50 miles from their surgical clinic having 3.47-fold higher odds of being lost to follow-up within 6 months. Okay, so that's like already setting up the stage for why this is important. That rural Texans are often lost to follow-up, and once they live 50 miles or more from a place, then they have 3.47 higher odds of being lost to follow-up. Okay, and then we have, so that's just one example of like justification. And then the resolved clauses. So what we want the TMA to do is that the TMA advocate for increased awareness of gaps in post-operative follow-up among rural patients and promote physician-led and health systems-based quality improvement efforts aimed at improving completion of ordered post-discharge laboratory tests, imaging, and specialty referrals. Okay, so that was one that essentially you're saying TMA should bring awareness to this issue. Not enough awareness is brought to this issue. Okay, second one, that the TMA encourage payers and health systems to reduce barriers to postoperative follow-up testing for rural patients, including improving access to mobile or home-based laboratory services, increased flexibility in laboratory site authorization, and supporting the availability of mail-in collection options when clinically appropriate. What that means is that the TMA should encourage like insurance companies and people that pay you and pay physicians to be more flexible with things that they approve and more flexible with the options that patients in rural areas have to get their testing done. And then the last one thing that we asked for the TMA was that they encourage payers to implement evidence-based communication interventions, such as text phone reminders and teach back discharge instructions, and to support telehealth and e-consult services with appropriate reimbursement mechanisms to enhance postoperative follow-up completion for rural Texans. So what that means is that the TMA should advocate for like these insurance companies and these people that pay physicians to reimburse these techniques that will improve post-operative follow-up. So like the teach back method or text phone reminders, that they should encourage these things to be reimbursed so that physicians are much easier able to do them. And then we can kind of get patients back into the clinic easier. Okay, and then the last parts of the resolution are what's the relevant TMA policy? What has TMA already passed? That's kind of in a similar topic. And then relevant AMA policy, what does the AMA have? Because that's important too. And then your sources, which are all like peer-reviewed sources or news sources. So that is a resolution, kind of brief version of that. And we submitted this to TextMed from the medical student section, and then it passed. So they adopted it, which was really cool because now that means that the TMA is going to do those things that we asked it to do, especially when it goes to the government, the state government. Okay, so let's see. And then, yeah, I'll let Yushra talk more about TextMed, the conference.
Yes. Okay. So, what Maryam just talked about, like the resolution and it passing, that actually takes place at TextMed. So it's obviously a very long process. Like Maryam is the one who started writing that resolution way before TextMed, which happens in April of every year. But it all leads up to this, where the resolution is then presented at the HOD session, which is what we talked about, the House of Delegates session, where everyone then agrees to either adopt the resolution, refer it to study, or not adopt it. So this is TextMed is TMA's annual conference. It's where the decisions actually happen, the main event. And like I mentioned earlier, physicians and medical students from all over the state attend. So it's an amazing opportunity for networking, whether you're interested in OB-GYN, pediatrics, ophthalmology, surgery. There are physicians and residents and medical students from all over the state. And the medical student section will have have specific meetings for medical students to actually attend. So if you are a delegate from your medical school, meaning you're going to be a voting member, and a lot of these delegates, it's like their first time like being a delegate. You know, they've never attended TextMed before. They've never seen an HOD session. And so but you don't need to be worried about all that, because the medical student section and like the executive board, like they are going to be with you the whole time. Like they're going to, when the HOD session is taking place, they're going to be sitting in lines with you, like where the medical students sit in this like huge room that you see like the picture of. And before the HOD session actually takes place, they hold a meeting for the medical students to come, and they teach you about all the jargon, like the legal jargon, the procedures, and how everything actually flows. So even if you don't know anything, you get like a quick like review of it, and then they're there in the room with you too, if you have any questions. And the medical student section also has its own like business meeting where we do our elections. So, you know, the EC, the executive council positions that we talked about, those are elected at TextMed. And at that meeting, they also talk about like different ways for medical students to get involved in TMA, different TMA events coming up. And so, you know, TextMed, if you go there as a medical student, there are things for you to do, even if you're not a voting member. There are medical student meetings that you can attend. You can also attend the House of Delegates session, even if you're not a voting member. You can sit in the back and just observe and see like what they're voting on, what they're discussing. And then there's also board, council, and committee meetings like Maryam talked about. So committees will meet during this time. And you can also actually, you can like join these committees, and they review the resolutions to see which ones they want to pass and discuss and have passed or like not pass. And they discuss that at those meetings, and then they bring that up at the actual HOD session. You can also provide testimony. So there's these little sessions that take place before the House of Delegates called RefCom. And so this is where it's the reference committees, so the different committees where each resolution is in, whether it's like the science, public health, socioeconomics committee, there's like 4 different committees that the resolutions can fall under. So you can actually go there and like provide testimony there. And so that's like a little mini session before the House of Delegates, or you can provide testimony at the House of Delegates session. And like we mentioned, you can attend House of Delegates even if you're not a delegate. There's also a poster session. You get a bunch of free stuff. So like this image on like the top left, there's like a bunch of vendors and like booths set up. And there's like, you know, people like, you know, physician insurance companies and just different things for that are related to like clinics and physicians and healthcare within Texas for you to go and look at and learn from. So in summary, and I think this is really important. So on the right over here, kind of what we've been talking about, you know, if it's kind of getting a little messy, this is kind of going to give you a flow of what we're trying to say. So if you're a student, you can write resolutions and the committee will then review those resolutions. It'll go to the House of Delegate where it'll be voted on. And if it passes, then TMA has now officially adopted that as one of its policies. And then that's going to influence legislation and healthcare. And they're going to advocate for that at the state level, and if needed, then at the national level as well. Okay, so this was also mentioned a little bit, first Tuesdays. So this is something that takes place on the first Tuesday of every month. And it's actually in Austin, so the state capitol building there. And it's an opportunity to directly speak to legislators. So a lot of the policies that TMA is passing, this is where you actually get to advocate for that with the actual legislators and tell them, like, this is what we think is important and this is why we think it's important. And one Tuesday, Maryam actually mentioned this, is focused on med students specifically. And so there'll be like flyers that go out and be like, okay, you know, med students should come out, and then there'll be also like a discount for like hotels that night. But you could also just do a day trip to Austin. But also you can attend any of the first Tuesdays. It doesn't have to be the one that's specific for med students. You'll just see more students at the one for med students. And no experience is needed. I've had a lot of friends go and they have never had experience, but they get to like be there. There's a lot of physicians that have a lot more experience, and you just kind of get to like tag along with them and see what this whole process is like. And this takes place every legislative cycle, which is every 2 years. And so this next year is actually going to be a legislative cycle. And then if we like zoom in, which I don't know, can you guys see me zooming in? But okay, if you can't, like if you zoom into like the first Tuesday's flyer, it says the 2027 dates on there. So February 2nd, March 2nd, April 6th, and May 4th are the ones for 2027. Okay. And so, okay, so now just we're going to talk about deadlines and the group me. So the group me is like a really great way to kind of be on the in of like the different events coming up, the different conferences coming up. So I don't know if we mentioned this already, but there's two main conferences that happen within the TMA. So there's a TextMed one, which is like the really big one. And it's like where HOD happens. So it's like where the voting happens, right? For all these resolutions that are being passed. But there's also a business and medicine conference, which is a lot smaller of a conference. There's no like voting that takes place, none of that, but it's more of like an informational session. And so the business and medicine one takes place in November. And actually, we're going to talk about this on another slide. So I'm not going to talk about that right now. I forgot. Okay. Yeah. So the business and medicine one takes place in November, and then the TextMed takes place in April. Okay. And then, yep, there you go. Yeah. And so I'm just going to talk about some deadlines right now. So pretty much for the EC applications, they take place in March 2027. There's no official date like on their website yet. So that's why I just put like March. And then the BCC applications. So to join a committee that like Maryam is a part of, and you can join, there's like so many different committees, whatever you're interested in and you have a passion for, you can join that committee. And like Maryam said, it's super low stakes. Like you won't understand every little thing that they're saying, but it's a great way for you to get involved, like increase your own knowledge, and then be able to kind of like build your experience within the TMA. So that is also March 2027. Okay. And then deadline for AMA alternate delegates, a Texas delegation. That's the position that I held. And that one is January 2027. So this is the one where you take TMA policies and you advocate for them at a national level at the AMA. And yeah, so it's January 2027. Deadline to submit a poster to present at TextMed. That's going to be December 2026. And then the group me is how you can be in the in. And so that is going to be, yeah, so you just fill out this link. It's like a form, like a consent form almost. And then you just like request access to the group me. And then these pictures over here, they're from like the different conferences. And these are all medical students. On the bottom left, that was actually the business and medicine conference, a smaller conference, but those are all medical students from throughout Texas. And I think Maryam's going to talk about this, but the business and medicine, they actually had a resolution writing workshop, which Maryam and I both attended. And, you know, like writing a resolution, like Maryam talked about, it may seem a little intimidating, but like it's really not. Like we had never written a resolution before, and you don't even have to attend the resolution writing workshop. Actually, the TMA Executive Council will hold Zoom sessions for you on how to do a resolution, and if you can't like go to a conference, and they'll actually like run through it. And but at the Business of Medicine conference, we like practice writing a resolution, and it's very simple, it's very doable. And then you, first of all, getting to impact healthcare policy, like, you know, Maryam started this resolution on her own, and it's like now official TMA policy, which is so exciting to think about. And also then, you know, obviously there's always the pressure of applying to residency and things like that. And so that's something you can talk about during your residency applications, which I think Fariya is going to touch on that at the end also.
Okay, so just to have it written down, these are the next TMA AMA events. We added AMA, so that's like they have their annual conference in June, and then they have an interim meeting in November. So that's coming up for AMA. For TMA, those are the bolded ones. You have the Business of Medicine conference in Irving. So if you're Dallas based, that will be an amazing opportunity, especially because that is a more educational conference. There's no voting, but again, like Yushra said, there's a resolution writing workshop. There's the medical student section meeting over there. So definitely worth attending. That was what we did in El Paso last year. And then TexMed 2027 is April 15th to 17th in Houston next year. And that's like the main event. That's the one I strongly, strongly encourage everybody to go to. And it's in Houston, so that's very doable for everybody, I'd say. So yes, these are the events to look out for, and please put them in your calendar.
And then one thing that we forgot to mention, I think, or we kind of briefly glazed over, but like, okay, you're like, how do I get funding for this? So if you're a medical student, there is funding for every chapter. Every chapter within Texas gets like a certain amount to use throughout the year. And a lot of that just goes towards their either service events and then like sending people to these conferences. So you can get funding through your chapter. You can also get funding, like if you're an EC member, you get funding to attend. And then I know AMWPA, they also want to start supporting students. So that's something that you can also look into. And so there's a lot of different opportunities to get funding and be able to actually attend these conferences. And there's also always a discounted hotel rate for these conferences specifically. And then, yeah, if you have questions, the TMA website, like all those deadlines I mentioned, if you like just go on Google and you type TMA MSS, so MSS stands for Medical Student Section, it'll have all those deadlines and how you can join the group meet and things like that. You do have to create a login. It's like very simple, and also it's all free. None of this should cost money to you, especially like as a medical student. And I know like Maryam and I, we talked about a lot, and it was probably really overwhelming. But like just to reemphasize, you don't have to understand all of this. The easiest way is to just start showing up, whether that's your like school chapter, because that's locally, go to our First Tuesdays, or even though it sounds a little intimidating, just show up to a TexMed. And even if you don't know what's going on, a lot of people, that's how I first got involved with TMA. I just showed up to a TexMed. I was super nervous. I was like, oh my God, what's going on? I saw Fariya and I was like, okay, homie's there. Like, it's going to be fine. Right. And like, I'll be there. And so if anyone comes, like Maryam will be there. Like, we're going to like hype you up. And that's kind of how like the medical student section works, is like, we're all very, because we know this is your first time probably getting involved in like healthcare policy at this level. Everyone is very supportive of each other in the medical student section. So even though it sounds really intimidating, like you're going to have a lot of support and you're going to have people you can lean on, and you don't have to know everything from the get-go. Like I started learning once I literally like put my foot in the door and just like kind of went into the deep end. And that's what Maryam did too, right? We just like threw ourselves in the deep end. We just joined, we like chose a position and we started learning that way. So you don't have to have like crazy experience to do this. Everything comes with exposure. I think Fariya can now talk about her, because she is, mashallah, you know, like a resident. So she's on the other side of things. So like how the TMA kind of like shaped her whole thing.
Yeah, Jazakallah khairan for a wonderful session, Yushra and Maryam. It's been very informative. I had a chance to get involved with TMA pretty early in my medical school journey and started with baby steps. So kind of walked through the initial parts that Maryam and Yushra touched on. I got involved with my school's chapter at first, and then slowly stepped onto some of the committees, got involved with the County Medical Society, and then eventually on a larger scale within the TMA. It's been a very impactful experience. And I think once you can see the impact that some of your contributions can have as a medical student, it's really fulfilling, and you get to see some of the reasons that many of us went into medicine is to bring that lasting change to the community. I will say that it was very impactful experience for me in helping shape my future interests within medicine. Additionally, it was very valuable during my residency interview process. I will tell you, I was asked about TMA in every single one of my interviews, and I'm very grateful for the experiences that I had. Hopefully, you guys have taken some wonderful points away from our speakers today and get a chance to start your own journeys with advocacy, whether it be to the Doctors Medical Association or a different organization. Okay, we'll leave some time for questions, but otherwise we'll wrap up with the closing remarks. I'm just going to read a short dua. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك. All right, we can stop our recording and we'll stick around for a couple minutes to answer any questions y'all have.